Bleddyn Rees. I am the Deputy Chair of something called the Global Health Connector. This indeed is our first event with our new name. We were formerly the ECHAlliance, which some of you, I hope many of you, may know of. So on behalf of the Society for Women's Health Research and the Global Health Connector, welcome to UNGA and the Science Summit this year. So this whole day is all about women and women's health, and I'm not going to expand on why at this time. But a couple of things I am going to talk about. So I'm going to explain who the Global Health Connector is, what we do, and why you should work with us. So, first of all, the world needs more connections. This is self-evident. So if you think about the pandemic, you'll have learned nothing if you didn't understand that healthcare knows no borders. That should be the lesson from the pandemic. What I wanted to talk about today, though, moving us along, is we believe the world needs an independent, global, trusted connector to drive change across the economy, finance, health, and science. Tomorrow, we'll be talking about that under the words convergence. But this is who we are and what we do. So a little bit then about who we're not. We're not a charity. We're not a lobbyist. We're not a trade association. We're not a vendor. We are an independent global platform that connects everyone to tackle health, well-being, and longevity. We're not just another network. We have spent 15 years building our infrastructure, which this slide very briefly outlines. So we have a connector program that curates global engagement. We have our ecosystems a bit later, which is our local intelligence network doing stuff, not talking about doing stuff. And then we have our strategic services that we deliver. So the areas in which we focus, our themes, if you like, are women's health, health data and digital, healthy aging, and cancer. These are some of the numbers that I'm not going to dwell on. The most important number in some ways is our 90 ecosystems or communities around the world. But what is an ecosystem? So this diagram is representative of all the different types of stakeholders who form part of each of our ecosystem. So this is everybody you need to bring about transformation in healthcare. So it is the hospitals, the primary care, the regulators, the departments of health, industry, all different types of industry that nobody knows are involved in healthcare, like energy and maritime. But it's also, at its heart, is people. So where are these ecosystems? So there are 90 around the world. So they go from Argentina to Australia, from Land's End to Timbuktu, from Singapore to Sao Paulo. There is nobody in the world that is doing the work that we are doing. So a little bit more. On the left, my left-hand side, you can see a list of the organizations that we will connect with and collaborate with. But the really important one I want to emphasize is people and communities. So at the heart of everything we are doing is about transforming health and care for people. But I want to also emphasize the fact that we do not talk about collaboration, we deliver it. We have trust, credibility, neutrality to bridge the gaps that others cannot. We call this collaboration. So you're going to hear that word a few times over the next couple of days. And then tomorrow we have a whole day talking about obesity and related non-NCDs. And what we're trying to do with convergence is to link the economy, finance, health, and science. So we believe these are often siloed, and we think there's a need for greater collaboration regionally, nationally, and internationally. So that's one of our aims tomorrow to try and at this whole Science Summit, to try and drive a better understanding of what we are calling convergence. So some examples of what we call convergence. So on this slide, you can see the Society for Women's Health Research, which is obviously all about research for women's health. UNITE is a parliamentary group of health MPs, and that's all about policy. And tomorrow we have a number of their members who are speaking on some of our panels. Health is the International Health Conference Organization, which is about dynamic destination for collaboration. GSMA, for those of you who don't know, is the Global Telecommunications Trade Association, and we have a number of people from GSMA here over the 2 days. So this is fundamental for us around digital health delivery, connectivity. How do you use satellite in remote parts of the world, whether that might be Africa or other LMIC countries? Health AI is a not-for-profit working on responsible AI development and use. And then McKinsey's Health Institute is about expert knowledge and research. So these are all relationships that we are developing in order to drive our convergence activities. I'm not going to talk on these, just to give you an idea of the type of activities that we do, also the range of services that we have. And then for the last 6 years, we have published virtual roundtable reports on the European health data space, so everything around digital data. And you can actually access these published reports of multi-stakeholder work. And then we do a lot of projects around the world, a lot of EU projects. These are some of our current ones. And the important ones here are, if you look, it's about health and data, it's about digital support tools, it's about skills and training for healthcare professionals, and then about healthy, smart living. So this is some of our activities, and I'm not going to talk about these again. We'll please spend time. We have a number of colleagues in the room today, so if you want to know more about what we do, talk to us. We'd love to talk to you. And then here's some of our global events. So we're just listing some of the partnerships we have. Our chairman, who isn't here but will be here later this morning, is just on his way back from Mumbai, having been at our event in India. If you want to, very quickly, you can scan the QR codes to get to some of our communications and get involved in our connector program. And then, just to end, I want to emphasize just a couple of things. So we're open for business, open for partnerships, open for impact, open for talks. So I make no apologies for explaining what we do and why we want to talk to people. So over the next 2 days, please do take the opportunity to talk to us. We're no longer shy about what we have built. We are proud of it, and we are here to grow with your help. So with that, thank you all very much, and I'll hand over.
Right. Collaboration. I learn a new word every day, and I might have to steal it. So thank you, Bleddyn. I am Katie Schubert. I am president and CEO of the Society for Women's Health Research, and I am really thrilled to be here. I had FOMO last year, so here I am this year, and excited to see all of your smiling faces for what is going to be a wonderful day of talking about women's health and/or the health of women. Let's see. So who are we? Just very, very quickly, we are a US-based nonprofit that was founded in 1990 to advocate for the inclusion of women in clinical research. And then we also worked to advocate for the sex as a biological variable policy at the National Institutes of Health. So anything that differently, disproportionately, or uniquely impacts women is an issue that we work on. And I think you all would agree that that is literally everything when we think about health and well-being, particularly women's health. So we have a variety of interdisciplinary networks. You can see the full list here. Our mission is to advance women's health through science, policy, and education while promoting research on sex differences to optimize women's health. So we do a lot to understand or point out gaps in research and data when it comes to women's health, and the disparities for women are pretty clear globally. And so you can see here, migraine is 2 times more prevalent in women than men. Endometriosis affects 10% of women. We know there are widespread disparities when it comes to maternal health and outcomes across the globe, whether that's here in the US or in other countries. Lupus is 9 times more common in women. 200 million women globally have osteoporosis. And the fact of the matter is, there's a lot that we do not know. There's a lot that we know we do not know. And so part of our work, working with all of you, is to try to understand where those gaps lie. And I think it's pretty clear when we think about the health of women that it's not something in a vacuum. It's not relegated to a disease state, a body part, a life stage. It really is, there's such intersectionality across the health of women, and this goes for all people, right? As you think about where you came from, where you're going, and what happens throughout your life. And so there's lots of different stages that we want to look at. And beyond that, the alarming thing is that women spend 25% of their lifetime in poorer health than men. And so there's something going on here that we have to address. We do know, however, despite those statistics, so I like to sort of bring everybody down, and then we're going to try to lift ourselves up, right, throughout the day. This is a global imperative. There is such a ripe opportunity for investment in women's health and research to advance not just the health of women, because we know when we invest in women that it will lead to greater prosperity, productivity, and economic value across the globe. The McKinsey Health Institute found that closing the women's health gap could yield 75 million disability-adjusted life years annually, which is the equivalent of adding 7 healthy days per year per women, and unlock $1 trillion in annual global GDP by 2040. So that is a huge opportunity, I think, for many of us. So last year, if you were here, these are the things that you did. You addressed disparities in health conditions that disproportionately affect women. You looked at healthcare policies and decision-making. We do a lot of that in our office as well. We highlighted barriers to accessing preventive care and medical interventions and spotlighted the power, and this is important because I do not think we talk enough about this, representation and leadership in the women's health workforce. We do know that if your healthcare provider, and I would venture a guess and say if the person doing the research looks like a patient population, they probably are going to be asking similar questions. So it is very important for us to keep that in mind. We do all of this aligning with the SDGs, which I know we will get to throughout the day. And here's sort of your charge for the day, okay? This year, we're looking at the global burden of diseases in women and how every individual can and should be involved. We're looking to discuss models for establishing national priorities on women's health, okay? There's lots of conversation about it. This is the ground level. We're looking at translating innovations across borders, promoting gender equity in the workplace, as I mentioned, looking at community-based care, boots on the ground. What does that look like? How can we do better for women? And then we want to spotlight how public-private partnerships are crucial to sustaining investment in women's health research. That is even more important today than it has ever been before. It was always critical, but we need this now more than ever. So I have to thank our sponsors, and I have a couple housekeeping items, and then I'm going to turn it over to Irene. So huge thank you to our sponsors who are listed here. We wouldn't be able to do this. Our strategic sponsor, Novo Nordisk. Thank you to Cencora, Ana Wave Medical, O Positive Health, and Johnson & Johnson as well. We really appreciate all of your support. We have our media sponsors, BMC, Springer Nature, and the Biology of Sex Differences Journal, which is a personal favorite of ours at SWHR. Thank you to Cure for allowing us to use this beautiful space. We so appreciate that. And thank you to the Global Health Connector for partnering with us again, and to the staff at Global Health Connector and SWHR, Heather at GHC, Irene, Sarah, Monica, and Serene at SWHR. You all did this. We get to come in and say the things and tell you where the bathrooms are, but they're really doing the work to create the agenda for the day. And so let's see, what else do I have? We have a great agenda coming. Thank you to our speakers for agreeing to join us today. We're really excited to hear from you. And then very last but not least, I've mentioned the bathrooms probably once or twice. They're out this door in the back, and you can go to the right for gender neutral. You can go to the left for men's or women's. Bleddyn already mentioned, please note there are drinks out here. Just keep conversation down because you can hear it if you are connecting in the space, and we know we can get loud when we get excited about talking about women's health. All right, today's lunch is sponsored by Cencora and will be served in this space at 12:25. Lunch will be in that back hallway through that same path that I just laid out for you. And during lunch, please go grab your lunch, come back in, mingle, chat. There are tables in the back as well for that. So I think that's it, yes? Okay. All right, then without further ado, I will turn it over to Dr. Irina Ninye, who is SWHR's Chief Science Officer for Establishing National Priorities to Advance Women's Health.